Christine MBULWA is back at work, days after her 7-year-old died of cancer. She earns $50 a month and has no medical insurance. She relied on public hospitals for her son's treatment. Hospitals were brought to a standstill last month when doctors and other medical workers started a nationwide strike, forcing Christine to seek help elsewhere.
At the
private hospital, they told us a session of chemo was 3 times higher than the public hospital. And I didn't have this kind of money. So I started looking for help again. And by the time we had enough money for his chemo, my baby died. I have lost my child. I am heartbroken. I have no joy left.
Christine says if there hadn't been a strike, her child could still be alive. Doctors are demanding the government implements the Better Pay and Working Conditions Agreement made 3 years ago. The strike has left public hospitals such as this one virtually empty. Each day the strike continues. More stories emerge of people dying or their condition worsening because they can't get treatment at public hospitals. Kenyans are divided on the strike, many taking to social media to either support or condemn doctors for abandoning their posts. Many other Kenyans are angry at the government and what critics say are its misplaced priorities.
As a doctor, you want to serve. You want to see a sick patient, even if it means you're up all night. You do whatever you have to do.
Doctors working for the state earn between $1,000 and $3,000 a month. Dr. WARUGURU WANJAU, who works at a rural hospital, says the strike is not just about a pay rise.
We do not offer care to the level at which we can offer it because we are missing sometimes basic drugs, sometimes basic equipment. A lot of the time we most of the time have one theatre team. It means if you have emergencies, we may have to cancel the surgeries you scheduled for the next day.
Union leaders say 96% of Kenyans depend on the public health sector, but little has been done to improve the poor state of hospitals.
It also gets to a point when you have to be aided to alleviate that suffering. And when the system is so broken that you may not be able to continue helping your patients, the ones that we love so much, then sometimes we have to take a step back.
Government leaders are threatening doctors with arrest or dismissal for striking illegally. With no end in sight to the stalemate, millions of Kenyans are left to suffer from the shortage of public health care. Fahmida, Al Jazeera, Nairobi.